Just going to share with you a quick case study to show you how I work. I don't just treat and train your symptoms. I actually take a lot of tests, and based upon those tests, we have more individualized, more specific treatment and training programs. So it's a lot more efficient and minimal effective dose, let's say. So anyway, this gentleman came to me a few weeks ago. He hurt himself lifting weights during some RDLs. So he had some low back, left hip symptoms since then. And although it happened a while ago, it healed, he has no more pain, but he's felt a difference since then. So it's been limiting his capacity to actually lift heavy weights and to actually run and do things he enjoys. So what we discovered a few weeks ago in his initial evaluation was that he was heavier on his left side. When he stands on scales, he has about over 20 pounds more weight on his left, and that's just standing relaxed. So there's no wonder why he has a lot of his symptoms on the left side. There's just excess tension there holding that position and putting stress in those areas. So long story short, I gave him a home program, just some like what I call neurological resets or neurological pruning exercises to do before his workouts or whenever he's physically active, so that it just resets his nervous system's awareness or sensory inputs of what's possible, right? To have him become more centered and grounded, let's say, on both sides of his body. So the goal is to get him more to his right, because he's way too heavy on his left. And his patterning, the way he's rotation patterning of his body from his head to toe, was biased to his right side, but he had this compensatory grounding, so he's putting a lot of compressive vertical force down to the ground on his left. So you can see how twisted somebody can become in that manner, especially when you start increasing intensity and volume of training or exercise. So he came back 3 weeks later for follow-up and put him on the force plates, and significant improvement, whereas before he was heavier on the left, he was actually 0.5% heavier or more average mean force on his right side. So that alone, after 3 weeks, was a significant improvement from where he was a lot heavier on his left. Now he's actually more centered, but he's a little bit heavier on the right side. And then a bunch of the other tests revealed that he was also better balanced. He had more balance, more postural stability on his right side. So he no longer had the tension around his left hip, low back area proximally, but he was now complaining he had symptoms in his lower leg, left ankle. And these symptoms are usually consistent when there's a disallowance or he's not able to get into the shape changes necessary to fully load his whole left side. He's better and he's not as heavy, but he still has like what I call a holding pattern, not from his left low back hip area, but still residual in his lower leg to ankle and foot. So the good news is he's more centered between his right and left side. So today, upon a reassessment, we taught him a whole new home exercise program to emphasize getting comfortably on that left side. And so he just did one of his new exercises, and I rechecked him on the way he was squatting, whereas previously he was squatting and he was about 7.7% heavier on his right when he was doing the average concentric. When he was pushing and standing up from a squat position, he was a little bit heavier on the right by 7.7%. So we did one round of his home exercise and immediately put him back on the force plates, and that improved to about 2.4% heavier or more force on the right side during the squat assessment. So that means that he was able to distribute his load and produce force more on his left and somewhat less on his right. So it's evening out. He's not where he needs to be, but he's going in the right direction. And this is all evidence, data-based, data-driven. So we're putting him on a program that's going to get him improve his sensory awareness or sensory input of creating force on that left side, right? And so we would then eventually progress him to testing him more ballistic or plyometric, or the stretch shortening capacities of his soft tissues, and max strength as well, because that's what he eventually wants to get back into, is lifting heavier weights without pain or threat of pain, and to be able to run and do these things whenever he wants to without that fear of hurting himself again. So that would be the progression, and this would be all based upon testing. And it's not like, okay, let's just throw him in and have him do this, see what happens. So let's see where he is through testing, and then let's see if we could create any or prescribe any specific exercises to improve that testing. Then let's have him train that, and then let's have him progressively overload and train and get his soft tissues to a higher threshold of tolerance of stress, so he can actually lift and earn the right to get stronger by lifting heavier weights, and also to be ballistic and springy and be able to run as far and fast as he wants to. So again, this is Jocson Physical Therapy and Training in Clermont, Florida. We do a lot of testing here, and we base all of our programs based upon that. So it's not just physical therapy, it's not just personal training, it's physical functional healthcare. Thanks again for watching.